Hello everyone, I'm Dr. Lekha Sri Anvarasan. Today we are going to have a quick overview of what helminths are. These are commonly known as worms. These parasites can cause a variety of diseases in humans, and understanding their life cycles, symptom, and treatment is crucial for any medical student. They are macroscopic multicellular organisms that can be broadly classified into three main groups: nematodes, also known as the roundworms, and cestodes, also known as the tapeworms, and trematodes, commonly referred to as flues. We'll go through each of these in detail. Let's dive into our first group, nematodes or roundworms. These are cylindrical, unsegmented worms with a complete digestive system. Many common human parasitic infections fall into this category. We have Strongyloides staphylococcus. This picture represents of this parasite. This nasty parasite's larvae live in the soil and can penetrate in the skin, often through the soles of the feet. Clinically, patients might present with diarrhea, abdominal pain, and distinctive papillovesicular lesions at the site of larval penetration. A unique feature is larva currens, a rapidly moving pruritic linear rash. If the larvae migrates into the lungs, they can even trigger a pneumonitis resembling Loveless syndrome. The good news is strongyloides can be effectively treated with ivermectin and bendazoles. Next, we have Enterobius vermicularis, commonly known as the pinworm or threadworm. Interestingly, about 90% of infestations are asymptomatic. However, when symptoms do appear, the classic presentation is the perianal itching, especially at night. In girls, vulval symptoms might also occur. Diagnosis is often made by the Scotch tape test, where sticky tape is applied to the perianal area and examined under a microscope for eggs. The treatment typically involves bendazoles. Then there are Ankylostoma duodenale and Nicata americanus, the notorious hookworms. Similar to strongyloids, their larvae penetrate the skin, usually on the feet. Once inside, they cause gastrointestinal infection, often leading to anemia due to chronic blood loss. Diagnosis involves finding their thin-shelled ova in the stool samples. Treatment involves bendazoles. Moving on to some other significant nematodes. First, Loa, a filarial worm transmitted by deer flies and mango flies. This parasite causes characteristic red itchy swellings called Calabar swellings, which can migrate under the skin. A striking though less common observation is the worm crossing the conjunctiva of the eye. Diethylcarbamazine is the treatment of choice. Next, we have Trichinella spiralis, an organism typically acquired by eating raw and undercooked pork. The clinical picture includes fever, periorbital edema, and myositis, as the larva encyst in muscle tissue. Bendazoles are used for treatment. And then there is Onchocerca volvulus, famous for causing river blindness. This parasite is spread by female flies. Its key features include blindness, hyperpigmentation, and potential allergic reactions to the microfilariae. The mnemonic river blindness and ivermectin helps remember the treatment ivermectin. We have iver in river blindness and iver in ivermectin. So we continue with Ucheraria bancrofti, transmitted by the female mosquitoes. This parasite causes a debilitating condition known as the elephantiasis, resulting from the blockage of lymphatic vessels. Diethylcarbamazine is used to treat this infection. Next up is Toxocara canis, the dog roundworm. Humans acquire this infection by ingesting infected eggs, often from the contaminated soil. It can lead to visceral larva migrants, where the larvae migrate through internal organs and retinal granulomas, potentially causing blindness. Diethylcarbamazine is the treatment. Finally, for nematodes, we have Ascaris limericoides, also known as the giant roundworm. Its eggs are readily visible in feces, aiding in diagnosis. While often asymptomatic, heavy infestations can cause intestinal obstructions. Larval migration to the lungs can also trigger Loveless syndrome. Bendazoles are the primary treatment for Ascaris infections. Then, moving on to cestodes or tapeworms, we have two major players. First is the Echinococcus granulosus. This infection is transmitted by ingesting eggs found in dog feces, making it a common problem for the farmers. Dogs are the definitive host and they ingest the cyst from the sheep, the intermediate host. The danger here lies in the formation of liver cysts, hydatid cyst. The most feared complication is anaphylaxis if a cyst ruptures, for instance, during surgical removal. The treatment of choice is bendazole. Our second cestode is Taenia solium. This one is often acquired after eating undercooked pork, while the intestinal infection is typically mild. Ingesting the eggs from contaminated human feces is what causes cysticercosis and most dangerously neurocysticercosis. This is where the larvae form mass lesions in the brain, giving a Swiss cheese appearance on imaging. There is a severe cause of epilepsy globally from this infection. The treatment again involves bendazoles. Finally, let's explore our third and final group, trematodes, also known as flukes. These are non-segmented, flat, leaf-shaped worms. First, let's discuss the Schistosoma hematobium. The disease is acquired when tiny cercariae released by the snails in water penetrate the skin, causing a transient rash often called swimmer's itch. The adult worms reside in the venous fluxus around the bladder. The characteristic symptoms are frequency and hematuria, blood in the urine. Crucially, chronic infection is a major risk factor for squamous cell bladder cancer. The good news is that this is effectively treated with praziquantel. Next, we have Paragamibus westermani, often called the lung fluke. It's caused by consuming undercooked crab meat. Once ingested, the flukes migrate to the lungs, where they can cause a chronic cough, hemoptysis, and often result in secondary bacterial infection of the lungs. The treatment here is also praziquantel. Our third fluke is Clenorchis sinensis, the Chinese liver fluke. This infection is transmitted through eating undercooked fish. The fluke settles in the biliary tract, causing chronic biliary tract inflammation and is a known risk factor for a type of liver cancer called cholangiocarcinoma. And the treatment is, yes, praziquantel. Our last trematode is Fasciola hepatica, the liver fluke. While less common in humans, it's important to know it can cause biliary obstruction as the large fluke physically blocks the bile ducts. While praziquantel is often a first order flukes, the specific treatment for Fasciola hepatica is bendazole, while praziquantel is often considered ineffective. To wrap up, the world of Helminths is diverse and the treatments often fall into a few key classes. Remember, the bendazoles, like albendazole and mebendazole, are your workhorses for the intestinal nematodes like pinworm, hookworm, and ascaris, and cestodes like Echinococcus and tinian. Ivermectin is your magic bullet for Onchocerca volvulus and also an ineffective agent against strongyloides. And finally, praziquantel is the primary drug for almost all the trematodes of flukes, like Schistosoma and Paragonimus. Just remember the exception, Fasciola hepatica, which is treated with triclebendazole. Understanding the transmission route and the organ tropism for each of these worms is the key to both diagnosis and effective treatment. Thank you for your attention. I'm happy to help. Please post in the comments if you need any topic discussion, any specific topics to be decoded in an easy way. See you until the next video.